Let's take a look at the outside of the sheep heart. This is the superior part of the heart. It's called the base. It's the widest portion of the organ. It is unusual for the base to be at the top of an organ. And the inferior part of the sheep heart, where it comes to a point, is called the apex. We can see where the four chambers are located. This flap-like structure is the right auricle. It's a little flap-like extension that comes off of the right atrium. Here is the left auricle. The rest of this tissue makes up the ventricles. We can see a lot of adipose tissue on the surface. That's typical. And you can see grooves on the surface where the coronary vessels travel. This is the interventricular sulcus. And this is the coronary sulcus. The coronary vessels that travel through these pathways provide oxygenated blood to the heart itself. Let's take a look at the vessels on the superior surface of the heart. This is the superior vena cava. The superior vena cava brings deoxygenated blood from the body into the right atrium. This large vessel on the top of the heart is the aorta. The aorta conveys oxygenated blood from the left ventricle to the body. And we can see the first branch off the arch of the aorta, the brachiocephalic artery. Let's look into the right side of the sheep heart, and in order to do that, what we need to do is make a cut from the base, which is the superior part of the heart, to the apex, which is the pointed inferior part of the heart, making sure to get the atrium in the cut. Looking into the right side of the sheep heart, we can see the right atrium, which is the chamber that receives deoxygenated blood from the body. Inside of the right atrium, we can see some muscular ridges. Those are known as pectinate muscles. This white fibrous structure is the atrioventricular valve. On the right, it's called the tricuspid valve. It's anchored down by these white cord-like structures. These are the carneae tendineae. The carneae tendineae work to keep the atrioventricular valves closed during ventricular contraction, preventing backflow of blood into the right atrium. They anchor onto this mountain of muscle called papillary muscle. This is the moderator band, which helps to distribute the signal for ventricular contraction to the anterior papillary muscles. The ridged appearance of the interventricular wall is known as Trabeculae carneae. Looking at the other side of the right atrium, we can see the opening to the superior vena cava. Deoxygenated blood enters the right atrium through the superior vena cava. Here is the opening to the coronary sinus. The coronary sinus empties deoxygenated blood from the coronary circulation into the right atrium. This open chamber is the right ventricle. There's one exit to the right ventricle, and that's the pulmonary semilunar valve. Deoxygenated blood exits the right ventricle through the pulmonary semilunar valve, out the pulmonary trunk. This is the pulmonary semilunar valve. This is the pulmonary trunk. The pulmonary trunk carries deoxygenated blood away from the right side of the heart to the lungs. To make a frontal section through the heart, what we want to do is cut the heart into an anterior half and a posterior half. And to do this, we can make an incision from the base to the apex, making sure to get both of the atria in the cut. The wall of the heart is made up of 3 layers. The outer layer is known as the epicardium. It's the visceral pericardium. The muscular wall of the heart is known as the myocardium. And then the smooth, slick lining of the chambers is called the endocardium. This is the right atrium. This is the atrioventricular valve on the right. It's called the tricuspid valve. And we can see it anchored down by the carneae tendineae. To papillary muscle. This chamber is the right ventricle. Inside of the right ventricle, we can see the moderator band. The moderator band helps to distribute the message for the heart to contract to the anterior papillary muscles. The pulmonary semilunar valve isn't visible in the plane of this cut. This is the interventricular septum. Dividing the right side of the heart from the left side of the heart. And right away, it's very noticeable how the left ventricle is much more muscular than the right ventricle. The left ventricle pumps blood out to the body, where the right ventricle pumps blood to the nearby lungs. Taking a look at the left side, this area is the inside of the left atrium. This is the left atrioventricular valve, called the bicuspid valve or mitral valve. The carneae tendineae. Papillary muscle. You can see the ridge-like trabeculae, carneae. The blood in the left ventricle exits out of the aorta through the aortic semilunar valve.